We had a lot of Pacific and Māori patients when we started in Otara. And the mainstream would say they don't care about their health because they don't turn up to appointments. But they don't realise they have no phone, they have one car, the husband's going to work, the mum's got 3 children, that there's no way she can keep an appointment if it happens to start raining. It's just logical. You have to look at the person you're delivering to, not judge them.
Tell me how you grew Tāmaki Healthcare. You started with just one clinic, you and your husband. How did you grow it into such a successful business?
Patient focused again, but that was actually more catalysed by mainstream and our peers constantly complaining about us, but because it must be that dodgy Indian couple doing something, because too many of our patients are going there. Not the fact that we were open, not 9 to 12 and 1 to 3. We were open from 8 o'clock to 6 p.m, which suited the people in our community, and so they would be coming to us. But we were audited and said, well, you can't see that many patients. So there's an Indian saying that when a light comes to your door, you don't blow it out. And so my husband said, we'll hire locums. And in those days, you only hired locums when you went on holiday because they were not cost effective. But he says, we're not turning anyone away. And so that obstacle became our opportunity. From downstairs small room, we moved upstairs, then we moved to another room, then we built a purposeful medical clinic. And the other thing we did was realise our families are very transient. School holidays, they will go to the mum's house to stay, the children would. So having a computer, and we installed computers in 1984, the cost of a house, $40,000 back then. And we had to install air conditioning for the dot matrix printer. So, you know, having that on a database was so important that our patients could go anywhere in to any of the clinics and be seen, which was access being our main priority, that how do we remove all the barriers. Our peers thought because we made it no appointment, walk-in and longer hours, that we were making the profession too cheap, not elite. And how ridiculous is that? Providing access to a community that needs it is our strength.
And famously, you always offer very low cost, if sometimes free healthcare to people who needed it. How did you make money?
The accountant always asks that. I think someone up there was looking after us. But you can't get blood out of stone. You know, if you don't have it, you don't have it. And you get to know the Mondayitis that are playing, you know, not going to pay and not going to do it. But mostly it was because they just didn't have it. They would come back on payday to pay, but we felt it was more important they put bread on the table. And once we knew people were abusing us, we would shut that off. But when we knew it was genuine, there's no use chasing it. We never sent out accounts because, you know, it's a waste of the time and money doing it. When people have it, they will come and pay you because they know you're there when they need you, not necessarily only when they can afford to have it, which is so important.
Was becoming wealthy always an important goal for you?
No, I don't think we ever expected to be the largest primary healthcare provider. But I think fortunes haven't. Once again, someone's looking after us. That opportunities came at the right time and we expanded. It wasn't all easy, but then everybody works hard, you know, so it's important to have the right people around you so that you can achieve what you want to do. We set out to be the best primary care provider, not necessarily the biggest. Both just happen to be hand in hand. If you deliver good service to people, you know, in those days people didn't go on the internet to find a doctor. They'll ask someone, do you know a good doctor? So the only marketing budget we had for 40 years was word of mouth.